So this is called general to particular. In here, particular is Bob McCarley and general is McCarley and colleagues and McCarley's team. This also we can differentiate into singular and plural. So as I told you that if there is a name in the question stem, we have to go to that name in the particular paragraph. So in the fourth sentence, we can see that McCarley later discovered. Later is the sequential expression. So if there is a sequential expression, then the answer will come after that sequential expression. So here, as adenosine level rise during sleep deprivation, so do concentration of adenosine receptors magnifying the molecule sleep inducing effect. This means that the level of adenosine and the adenosine receptors go up at the same time. Then again, we can see that the brain has cleverly designed. It means that it shows emotions. It means that impression of Bob McCarley. So we can confirm that our answer is option C. This is the paraphrasing of option C. Simultaneous production means that two different things happening at the same time. That is adenosine and adenosine receptors. So we can confirm that our answer option is C. Could you please change the slide? So let's see why other options are incorrect. Option A, the effectiveness of adenosine as a sedative is true. This was an earlier finding. That is, McCarley's team was found. So we can eliminate option A. Then option B, the influence of caffeine on adenosine receptors. The text mentioned that caffeine block receptors, and it should come as no surprise. But our question is asking about impression of McCarley. So we can eliminate option B. Then option D, the extent to which adenosine level fall when subjects are allowed to sleep. Text is mentioning that slowly return to normal. So we can confirm that our answer option is C. Thank you.
Justina Joy, you have explained very well. So thank you so much. Next, I would like to call Samzana. Samhana, I think Samzana, no, 32 episode. So you're most welcome. Samjana, are you there?
Yes, sorry. I think the network issue, sorry.
Okay.
Yeah, am I audible now?
Yes, you are.
Okay.
Okay, so
Good evening all. My name is Samjana Tamang, one of the OET aspirants from Edu Skills International. First of all, I would like to thank Dr. Father Solin Joseph, the admin team, panel members, and all the participants in this group for giving me the opportunity to speak in this episode. Now I'm going to present with episode 32, name-based questions, and topic sleep deprivation. Here, in the 13 questions, 13 number question, what aspect of her findings surprised Saira Sirelli? And here 4 options. Answer option A, there was, in the question options, we can highlight the hedging words surprise. Yeah. Then Saira Sirelli. This is a name. We can highlight the Saira Sirelli. Then here is a 4 options. A, there was no reversal of a certain effect of sleep deprivation. Answer option 2, the cortical neurons of the mice underwent structural changes. Then option C, there was evidence of an increased need for energy in the brains of the mice. Then option D, the neurological response to sleep deprivation only took a few hours to become as apparent. Could you please, next slide, please. Next slide. Yeah, thank you. Here in the questions, we can highlight the hedging word surprise. This is a emotion-based hedging words. Then Cyrus-Riley. This Cyrus-Riley is name-based hedging words. In the answer option A, we can highlight no reversible. Then option B, we can highlight in the hedging word structural changes. Then option C, we can highlight increased need for energy. Then D option, we can highlight the hedging words neurological response. Then according to further strategy, principle of name-based questions, always if name can be any person or device, here person's name. So any name, person, device or organization, whatever name we can see, so we can highlight the name. Then after that, we have to go immediately in the text name. Then just we can search name in the paragraph. So here we can see in the question options there is asking Cyrus-Riley. So in the paragraph we can see Cyrus-Riley's team first. This one is one name. Then another one Cyrus and colleagues. We can highlight name. Then another name, she says. She says means Cyrus-Riley says. This one also pronoun she. And says means opinion based hedging words. And here we can see in the text vorism. This is emotion based hedging words. Then after that we can see one contrast word. After she says, after emotion based hedging words, we can see before emotion based hedging words we can see but. This one but is a contrast word. According to further strategy, if we can see contrast word in the paragraph, always we need to follow the after contrast word. Answer will be there. Then another name is Cyrillus says. Here also one names. So according to question says Cyrus-Riley means only one person, means particular name. So here in the text first Cyrus-Riley's team. So this one we don't need it. So we can easily eliminate it. Then another name Cyrillus and colleagues. This one also we can easily eliminate it. Then after that, could you please slide the next slide, please? Next slide. Yeah. Thank you. Yeah, it's okay. Thank you. Here in the text, she says means we can eliminate this Cyrus-Riley's team and Cyrillus and colleagues. This one we can easily eliminate it. After that, we need particular name. She says unexpected changes. This one also important things because this one is Cyrillus' opinion. Then after contrast word, we can see vorism. In the question stem also we can see surprised. Then here vorism also emotion based hedging words. Then after finishing emotion based, here after contrast word, it's vorism because it's only 4 to 5 days of the sleep deprivation, says Sireliz. After 36 hours of after 36 hours of sleep recovery. So here what happened? I think it's a slight problem. Period during which the expected normally to resume. Those changes remain. So in the question stem, asking what expect of finding surprise Cyrus release. So we can go in the four answer option. So in the first A option, there was no reversible, means those no change, means those change remained. That means no reversal of synonyms, yeah, of the certain effect of sleep deprivation. Then B option, the cortical neurons of the mice underwent structural changes. This option is Cyrus release team opinion. So we can eliminate this one easily. Then C option, there was evidence of an increased need for the energy in the brain of the mice. This opinion is Cyrillus and colleagues. This one also we can eliminate it. So in the D option, the neurological response to sleep deprivation only took a few hours to become apparent. Here in the text mention 4 to 5 days, but in the question answer options a few hours. So another thing is only took, only also absolute word, so we can easily eliminate this option as well. So we have only remain one A option. And in the text also, after contrast word, in the last those changes remain. That means no change or no reversal. No reversal. That's why A option is our right answer. Thank you. I hope I clarify my doubts. Thank you.
Yeah. Okay, yeah, you did nicely. Okay, I would like to tell you something about this one. No, actually, in the question stem, if only one name is there, then you have to go straight forward to that one name only. Okay, so if you suppose say Cerily and colleagues, that is already that two name plural, plural. Okay, then if it is Cerily means singular. Okay, so you have to direct singular name so that it should be easy. It's not going to be your time. No? So that's I want to tell you. So anyway, you did nicely. So thank you. So now I want to call Madhusri.
Good evening, everybody. Am I audible?
Yes, ma'am.
Well, I'd like to thank Father Sally Joseph sir for giving this opportunity to be in this platform. And I'd like to thank the coordinator for the today's discussion session. Today, I'm going to take the episode 33. So, can you have a slide, please? Yeah. So the first slide. So as we are seeing about the name-based questions, the clue is the name. So whichever the names, it may be the person's name or the place or the any disease condition. So whatever the name, if you're finding, we are going to scope into the name particularly in the question. So based on the name, we are going to identify the answer, or we'll see like how to find the answer in the text. So started with this, let's scoop down to the name. So as soon as we see the name in the question, we are going to check with the text. So in the question 16 number question, the researcher by Nauchin Achkani into CSD. So in the first, as soon as we see the question, we have to scoop into the name. So what's the name here? It is Nauchin Achkani. So and the CSD is the condition. So as soon as we see the question, so we are going to identify the name. So we are going to highlight the names, whichever it may be the name of the person or maybe the conditions. So first after finding in the question, the highlighting the question name, so we are going to check with the text. So wherever the question, so person name is there or the condition name. So can we have second slide, please? Next slide. Sorry. Yeah. So here, see, we have seen in the question, Nauchin, Achkani, and CST we have highlighted. So in the same in the text, we have seen like in the 7th or 8th line, we have found the name of the person, that is Nauchin Achkani, as well as along with the team it is. And again, so we are going to see the person's name. So that is in the like last third line of it. So whenever we found the name, so it's not like at the first name itself we found the answer. Always we should go to the recent name. So that is it may be at the last of it. So based on that, we are going to check with the answer. So once we are finding the name in the question stem as well as in the text, so next we will highlight the what are the important like keywords are there in the options. Next slide, please. Next slide. Yeah. So here it is. So in the options, we are highlighting the keywords as like as relevant than. So in the first option, it is less relevant. So and then the second option, so the result. So the result may be whether the result is accurate or it is conclusive or it is not accurate. So what kind of result we are going to identify? So based on that, we are going to highlight it. And then the third option, it is complicated. And the fourth option, it is overturn. So after highlighting the keywords in the options, so we are going to scoop check with the text. So what are the the similarities that can be seen in the options as well as in the text. So in the first, so as the question says, it is the opinion of the Nauchin Adjani only, not anybody else. So when we say about the research papers and notes, there may be a different paper who gives their opinion. So now we are going to scoop it only into the Adjani's opinion. So what is the so here in the second line, it is like it is about the many scientists speaking about the condition. So that we don't need to we don't want the many people's opinions. We want only the Achkanis. And the next step when it comes to the Achkanis and her team speaking about the issues. So at the last, it says like Achkani admits, however, that other work she has done suggests that CSD may occur all over the brain, often unnoticed, and may even happen in healthy brains. If so, Hora may be the result of a person's brain being more sensitive to CSD than it should be. So here, so there is, however, the contrast words, and then there are suggest is the what is the opinion of the Achkani. And then again, so CSD may occur. So may is it's also a modal verb. So the presence of modal verb repeatedly say may occur all over the brain, often unnoticed, and may even happen. So again, the may or maybe. So that is the modal verbs which indicates, so the maybe answer may be near to the in and around these sentences. So after finding out this kind of modal verbs and then contrast verbs, so we have to we have to check with the options. So which will correlate with these sentences. So in the option second, so it says that it did not result in a definitive conclusion. So here in the last three lines, it's saying they're saying that it may be. So they are not telling it's exactly these things are happening. So they are going to suggest it might be. So that is relating to the B answer. So that is result did not result in a definitive conclusion. So they are not telling that it's a exact answer or like exact conclusion has not been given. Can you have next slide, please? 6. See here. So it did not result in a definite conclusion. So as we are getting, so why we should also analyze that why the other three are not related to the answer. So the first option is has less relevance with the many beliefs. So as we know, we are going to have the opinion of Achkani. We are not going to speak about the other people. So it says that we are many beliefs. So different people's beliefs. So first option we are going to eliminate because of they are speaking about the overall beliefs or the suggestions. So in the third option, it says that was complicated by technical difficulties. In this text, there is nowhere they mentioned about the technical difficulties, as well as the overturned years of acceptable knowledge. So even what is so they're not speak about the anything regarding the knowledge like acceptable, like what has to be acceptable. So these things, so it is not present in the text. So that makes us to easily eliminate the options. So by eliminating A, C, and D, so we'll come to know that B is with the answer. So next, like after finding out this, so to analyze all these things, we should have a summarization. So text after reading this text, so we need to know what all the key words, key points we have identified. In summary, is summarizing like how we are going to say is in the first stanza, like first paragraph, first 3-4 lines, we came to know that. So the research is by many scientists. So they speak about the many scientists. So, but we want the answer by the Achkani. And then the second, 5-6 lines, they'll be speaking about the again. So with the team, Achkani and her team. So that's again, it is many people. So, but we want the answer from opinion of only the Achkani. So and they also mentioned that she recorded an episode of CSD in a brain scanner during migraine aura. That is in the in the team when they are discussion. So they'll have the opinion also. So at the last, our own other studies disproved these findings. So Aura may be the results of a person's brain being more sensitive to CSD. So next slide. So again, summarization is like we have to find the question, so apply the strategy. So we're going to scope into the name and then look into the answer, which is correlating to the name as well. The next slide. So again, so the way we are going to summarize it. So finding of many scientists and then finding of Afghanis and along with her teams. And then at last we found the opinion of the Achkani, and the conclusion is like uncertain. So it's not compelling. So it's not an exact conclusion which has been given. It may happen. So that is what the results of the study has been shown. The next slide. So we need to understand, we have to, whatever the text we are going to read or understand. So after understanding, we have to make it in a short. So that may be like 200 of words. So 200 205 words. So that has to be make it short. So that shows how we have understood the paragraph. So as we understand, so it's easy to scoop into the answer. Next slide. The next slide. I think one more is there. Okay. One more 11th slide. Okay, I had a question along with.
Can you wait?
one more last slide. It was like correlating with the questions and options as well as the like answer words. So there we've seen like attorney confirmed.
I don't find your this thing.
Actually, I had shared. It's okay. So there we will see like in the options we have some like overturns. The overturn, it is like it's not a, it's a confirmed text. Okay. So always, so the summary of this summarization is like always we have to look into the question. So in the question, whatever the name we find, so based on the name, we are going to scoop into the text. So after that, so what is correlating? So in the text, what is correlating to the like we have to highlight the options. In the options, keywords need to be highlighted. So based on that, we will find we're going to search the answer content in the text. So then we are going to correlate with the answer as well as the text. So once we correlate, we'll come to know what has to be eliminated and what is the exact answer we're going to come to know with the like strategies, with the further strategies. Hope I have done my best. Thank you.
Yeah. Okay. Thank you. I think you have explained very nicely. And I'm so sorry. Actually, I have an internet issue, so I couldn't present. I mean, I was not present in your time. I'm really sorry for interruption. Okay. Anyway, you all did very great, very nice. And in between some portion, like I think some Hana, she did much well. So you did well, and Joshina also, she explained very well. And so over to Father Salim.
Good evening.
Good evening, Father.
Good evening, Father.
Yeah.
Good
evening, Father. Good evening,
Yes,
Father.
all did well. Good discussion.
Thank you, Father.
Yeah, all the three attempted well. Jana, Madhusri, and who else? One more of us?
Josina, Father.
Josina, yeah. All three did well. Excellent.
Yes.
Nice to feel proud of you. It's not an easy task to teach OET in this powerful way. So you can be proud of yourself. Any concerns before we move on to something else? We can take 1 or 2 minutes break, snacks, grab some snacks or juice, tea, coffee, whatever, so that you enjoy the journey. We'll make it very short as possible. But then since we are going into listening, part A, we'll have to take one audio extra, this one, that will contain 12 questions. We'll do reading and listening both together and see the importance of names. Okay. We'll be practicing a new method of listening, which I have never taught so far. If at all you have challenge in improving listening, we will teach you one new method. Okay. Presuming you have watched the videos, if you have not attended the sessions.
Thank you, Father.
Yes.
Thank you, Father, for learning. Everybody's brain is not in a way everyone think. May this useful to us. Thank you, Father.
Yeah, but the discussion, everybody is doing great.
Yes, Father.
That gives a command. It's not easy. Even the teachers in various institutes will never be able to teach the way you teach now.
Thank you, Father.
All are doing great. Only make sure that you position yourself inside the camera, okay? Otherwise, sometimes what happens, your half head is broken or half body is not seen. Or let's say that you sit in the middle of the screen, Sini, Lini, all these people, even Varsha, always you are only half face is seen. Yeah, always see that you are to the top. See how I sit. If I sit on the corner or half of my face, I'll not be appealing, right? And also, if at all I have to edit something, that looks very, very challenging and it's very difficult because one side will be vacant of the screen. Yes. Harsha, try sitting straight. You practice it, yeah. Because some of you, when you present, you go down, then it's not appealing. Still more, still more, still more. Yesterday also I corrected. Yeah, you have to keep your phone somewhere, okay? Otherwise, what happens it disturbs the listeners. Not shaking, vibrating. Always see that your phone is stable somewhere. Even if you don't have a stand, you can keep some books and arrange. And it has to lean forward. Now our Shai is sitting backward. Phone has to lean forward so that you are closer to the screen. See how I position myself? My body, nowhere it's cut because of on the edge of the screen. So see, yourself can manage. All those who are doing discussion, practice that, okay? See that you are full in the screen. Reach maximum, almost top. A little gap on the top. Yes. Keep smiling. Are you ready?
Yes, Father.
Snacks break.
Yes, Father.
Yeah.
Yes, Father.
So maybe you'll have to hit the chat. Only 3. Chat rate is just 3. We'll go with 30. Everybody at YouTube also please like. Click the like button. Hit the chat box. Thank you for all the super chats. Rosina Joy, Rini Verghese. Super chat means you have a crown with your message, and the green name with green colored name with a star shows that they are the registered members of the platform. Rini Verghese and Chandra Vardhana Kumaran, 2 of them. Yes, thank you for supporting. Yes. Yeah, you can try. You can click on the button below near your this one message box. Click on that dollar button. Just it starts from 10 rupees, Indian rupees. Everybody, I wish those who can afford, those who are working. If you're not working, don't do it. It's much more than the money. We can reach out to more people. Smile and click on the button and get a super chat. If everybody has the super chat, we'll have 10 times more reach. Okay, I need not keep on repeating every day. Yes. Thank you, Miss Severest. She does it every day. And yeah, thank you so much. Thank you so much. Those who are doing it, do it every day. Others can try. Maybe sometimes we are hesitant how to do it, but you can try. Right? It's not the money, 10 rupees, Indian rupees, but the reach we get. Yes. So once again, good evening, good afternoon, good morning, wherever you are from. Any part of the world, your own time zones, we greet you. And happy Nurses Day, wonderful day of your day, special day. So I thought of teaching you a special method of listening today. And maybe actually as per Indian culture, on Nurses Day, we should have given holiday, right? But you don't expect, I believe. All right. Is there any complaint? I didn't give you holidays. So welcome to EduSkills. So it made easy if you're watching this on YouTube. Kindly consider subscribing to the channel. Give us a thumbs up if you like our mission and share the link to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. So this is an absolutely free platform. All the resources, sessions, and recordings, everything will be free here. We don't charge for any of our services. This platform is of the health professionals, for the health professionals, and by the health professionals. So let us reach to everyone. Let there be no one in this world or no health professional in this world who is struggling to crack OET because of financial or emotional problems. Okay. Hope to reach. Let me share my screen. We are going with the same thing. One we will do from Measuring the Life, same thing what we did, continuation, another question from the same text. Okay, after that we will go on to listening. Okay, since we are doing the reading. Am I audible and visible?
Yes, Father.
At YouTube?
Yes, Father. Yes, Father.
Yes, at YouTube as well?
Yes. Yes.
Yes. Which statement is not true? The neurologist who made initial connection with ApoE and Alzheimer's believes people with, what are the hedging words?
Neurologist.
Not
It's not
true.
true.
Not true.
So is very important. Means which is not the answer will be the answer here. Okay. Most of the
Yes.
people will make a mistake here because he will see exact statement in the text. Then you say this is right. Okay. But then what is not there in the text or something that is opposite of what is given in the text will be right answer. Next, any other hedging words?
What?
Neurologist.
This is the designation. Okay, like yesterday, I am giving you one step ahead. If at all you get a designation, how to reach the designation. So you have to find a neurologist, a name in the text, who made initial connection. Initial connection with the appearance. Believes people with. You have to read this statement with all these four statements. People with A, people with 2, E4s are more likely to develop the disease.
More likely.
More likely.
Give me 1 sec, okay? Just 1 sec. Yes. Then 2 E4s also you can highlight because there are difference, not all the same, right? 2 E2s are there. Okay, option B, people with 2 E4s are more likely to be protected by it.
More likely.
More to be protected by.
Protected
By. Develop first. Develop.
Developed.
See, people with 2 E4s are 6 times more at risk of vulnerability to Alzheimer's than others.
6 times.
More likely.
More.
Vulnerability.
6 times more. Okay.
Risk of
Vulnerability to Alzheimer's. Yeah. If you want, you can highlight anything. That's all left to you. Yes. Option D, people with 2 E2s are less in 15% of general population who have the disease.
Less than 15%.
15%.
Disease.
I think it should be less than. I don't know.
Less in.
Less than,
Yeah.
whatever.
Not incomplete.
Less than 15%.
Okay. If it is less than, definitely that has to be eliminated because of incorrect grammar. I don't know whether text there is some problem in copying. Whatever. Let's see. Then. So anything else? Anything else you find here?
2
Neurologist.
Other.
Pardon?
2E. 2
E2S.
2E2.
Okay, 2 E2s.
Can highlight.
Other 3 are 2 E4s. Anything else in the first and second option? Anything?
It's more likely it's a common.
Course.
2 E4s are more likely to develop the disease.
Unprotected.
Protected by it.
So
Protected by
opposite
means
father.
no disease.
Opposite father.
Yeah, opposite father.
These are two opposites. One is says will develop the disease. Other one says it will protect the. It will be protecting the person from disease. So they are opposites. So the
CD and
principle of
eliminate.
elimination. So
Other
principle.
Other two are
eliminated.
eliminated.
Yeah, other two are eliminated is the Putative principle. Yes.
Okay, not true.
Okay.
Father, come again once, please.
Yes. Here you see 2 E4s, 3 E4s more likely to develop the disease. Means it will develop the disease. Second one says it will more likely to be protected by it. 2 E4s protect the human being. Other one says it will develop the disease. So they are opposite, right?
Yes.
One says that will cause disease. Other one says it will protect from disease. They are opposites, right? Ganesh?
Yes, Father.
Exactly opposite.
Yes, Father. Got it,
One
Father.
says 2 E4s will develop the disease. Other one says it will be protecting the person from the disease. So one of them must be the answer. Now the neurologist means a designation. So you have to go to a name of a neurologist. Anywhere you have the name, just scan fast.
Further, the second last sentence. Due
Dr.
curiosity
Alan
neurologist.
Roses.
Yeah,
What
second
is
lesson.
it?
Alan
Yes.
Roses.
Dr. Alan
Where is it?
Roses.
Alan
Last.
Roses.
Last
Third
Last.
line.
further.
Last third line.
University neurologist.
Okay, Alan Roses. So one more step ahead, we have the neurologist here, designation. So you have to find the reference. To whom does neurologist refer to? So Alan Roses, who first made the link?
Initial connection.
Any connection?
Initial.
Initial connection.
Initial connection here.
Connection.
Between FOE and Alzheimer's says those with 2 E4s have about 6 times the normal risk of developing the disease.
So option B. Protect.
2 E4s, while people born with 2 E2s may be protected from it.
Other A. B option.
A.
A option.
A option.
A.
Not true.
Which is not true.
It's
Not
E4
true.
about. We are speaking about E4.
You have to say what is against the text or what is not given in the text.
Oh, yeah.
B.
Go, you are going to the right answer. You are going to the right
Not.
answer. This is very tricky. Most of them will go to the right answer because you see exactly what is there.
B. Father.
2
Yeah, B.
E4s, what Dr. Alan Rose says, 2 E4s have about 6 times the normal risk of developing. But here it says 2 E4s are more likely to protect it by it.
Yeah, that's not true.
Just
B is the
opposite.
answer.
B is just opposite of what is said by which statement is not true. The neurologist who made initial connection with OPOE and Alzheimer's believes people with 2 E4s are more likely to develop the disease. 2 E2s may be protected from it. Just opposite. 2 E2s will be protected. 2 E4s have 6 times chance. Did you get it?
Yes.
But here it is saying more likely to be protected by it. Here it is saying 6 times they are at risk. The text is speaking, what I highlighted in red is speaking against B.
Yes.
Okay?
Yes, sir.
Text,
See?
Father, it's talking about E2, but option is E4.
2 E4s.
No E4.
2 E4s.
Two
This is 2
E4s.
E4s. This is 2 E4s, right?
Yes, Father.
Pardon?
The instance of 2 E4
This is
No,
this
is
is
10
not
times higher than
no,
the
this is for your understanding, not very authentic material, but more or less 90% authentic. But then here it is 2 E4s, right? 2 is written
that is
in TWO. Here 2
Yes.
E4s are more likely. Here have about 6 times the normal risk. Means 6 times risky. Here they say they'll be protected by it. Okay?
I think that last two
Protecting this option B and the last one.
two
E2 may be protected from it.
this one is
Maybe.
less.
Maybe. Okay.
It's maybe more likely option B.
We are talking about E2s, two E2s. And in the MCQs, they are talking about two E4s. So what is not true, not available
Yes,
is
Father.
like that.
So this is less than the answer options actually. In that
Now,
text,
this is like, this is opposite of what is given in the text.
Yes. Yes.
Opposite means not true.
Not correct.
Got it?
Yeah.
Yes.
Here it says 2 E4s have about 6 times, means text says in simple language, 2 E4s if you have, you are 6 times more vulnerable to have Alzheimer's. But option B says if you have 2 E4s, you will be protected from Alzheimer's.
Okay.
Do you understand?
Yes.
Yes.
Text says If you have 2 E4s, you will be highly vulnerable. You have all the 6 times possibility of
Developing disease.
developing Alzheimer's.
Yeah.
Whereas the option B says, if you have 2 E4s, you will be protected. You will not have Alzheimer's at all.
Mhm.
Okay?
Yes, Father.
Yes, Father.
Is it clear?
Yes.
Yes.
Yes,
By
Father.
elimination method also we can eliminate easily.
Yeah, that is not actually required when there is a name, but still we thought we will look for it. Now you see this portion, we don't bother at all until the name, right?
Yes.
That's
Father,
how we.
Father,
Yes,
option
please.
B, there
Hmm.
is 2 4s, and here E2. So I think they have, they have written mistake, or I don't know.
Now here we are looking for the wrong answer, not the right answer. What
Okay,
is not true, that has to go into your brain. What is not true according to the test?
okay.
Not true means not correct.
Yes.
One of them is not correct as per the text.
Yes.
Text says, if you have 2 E4s, imagine, just mute the second instrument if you have one. Okay, it's better to have 2 instruments to, or you will zoom the screen and all that, but then mute it. Okay. Now, the text says, if you have 2 E4s, you will be definitely, I'm just putting in a simple way, definitely you will develop Alzheimer's. Option B says, if you have 2 E4s, you will be protected from Alzheimer's. You will never have Alzheimer's.
Okay, Father, I understand now.
Okay. So this, no, you understand now, but majority, I tell you, 99% of the aspirants lose their mark here, unless you are very alert. Because you will see exactly the same answer somewhere, you will say that is right. You will see a match of one of the options in the text, exact match. And you will mark that as the answer. But here they are asking what is not true. It's a tricky game. Okay?
Yes.
So what you have to read only this one. When you have neurologist, okay, you have to straight away go to
Neurologist.
the referent. This is also called name reference question. Name reference question. Only this green portion you have to read. So how you can manage time is 6 times the normal risk. Okay. And if you want explanation, this is name-based reference question because it refers to the neurologist who made the initial connection. Dr. Alan Rosa states that E2, not E4, may offer protection. Okay. Therefore, option B is incorrect and becomes the answer. Okay. It becomes the answer. It is incorrect. Option B is, in normal cases, option B is incorrect. Wrong answer. But since they are asking what is not true, this is correct. Wrong is right here. Which option is wrong is right here. Got it?
Yes, Father.
That's a slight inauthenticity of the material. I don't want to highlight it because you'll get confused. It's okay. But then you get the clear strategies here. Are you ready to jump into listening part here?
Yes, Father.
Yes, Father.
Yes, Father.
Yeah, hoping that you know the basics, even if beginners, even if you don't know the basics, it's cool. Take 30 seconds to scan. We call those 30 seconds as anybody? Golden seconds. 30 golden seconds. The patient notes on this page, then listen to the track and answer. Means 30 seconds. I'll show you how to make use of that 30 golden seconds to achieve A+ grade. So you hear an obstetrician talking to a new patient. Every word is important. New patient means first time they are meeting. They are meeting first time. Called Melissa Gordon. Okay, complete the notes with a word or short phrase. Now we are taking a different stand, okay, here. Right? Now listen to the audio and read these questions. Okay, listen to the questions. Concentrate on the questions. Okay.
Okay.
We are not looking into the notes now. We are trying a different method.
Father, no voice.
You cannot
Not
hear
only.
anything.
Oh, sorry. You'd have told me. Oh, I thought you are listening.
No, actually, I also thinking, Father, you didn't start yet.
I started and I was off the way. Okay. Now, introduction is not required. Now you have to think of it if you can scribble something. I said multitasking is very, very important skill here. Multitasking means, can you see the screen now?
Yes,
Yeah,
yes.
Father.
Yes, Father.
Yeah. Multitasking is
Yes.
important. You have to
Yes.
read the questions,
Reading, listen,
listening, and
writing.
writing. Mark the
writing.
answer. So, if you can write something about each question, what do you predict, foresee? Okay, as you have heard in first method, here also you can foresee from the question what could be the answer. Okay, just write down.
Screen is not clear.
Screen is not
Not clear.
It is blur.
Not
Yeah,
clear,
it is
Father.
blur.
Maybe
Blurred.
network issue. I did not have network at all. Today I could connect only at exact time. You can't see the screen?
It's
Yes, Father,
only
I
it's
can
clear,
see.
Father. I can see.
It's not
Father.
clear.
Me too, I can see.
Blurred.
How many of you
Me
say
too.
clear at YouTube? Just comment so that we know.
Clear,
I
Father,
will.
clear.
Father, it's clear for me.
Clear. Those who are clear, just type in the. Sometimes your own network issue can make it unclear. If it is clear, type in clear. Otherwise, I will stop sharing and again I will try sharing.
Not clear.
Clear. Yeah, those who say clear, please type in clear at the chat box, YouTube chat box. Those who can read the screen. Or do you say that particular portion of the screen line is not readable? I can change the color.
I think, Father, you better change the color.
Now it's clear. Now it's clear.
Pardon?
Now okay,
That's
Father.
clear.
Now can
Okay,
see.
that's
Yeah.
clear. Okay, Father. People are saying maybe I will stop sharing one more time. Let me check if that helps me. Okay. That's because of I had a lot of network issue because of the road construction going on here.
Yeah, it's clear, sir.
So you are going to listen at the same time along. They will be asking the same questions at the same time. Presume what could be the answer. Okay. We are not going into the questions, real questions. Okay. These are not real questions. These are the questions asked by the person, asked by the specialist, doctor, to the patient. These are not the real questions of 1 to 12 questions. These are not 1 to 12 questions. Okay. These are the questions from the audio. I am trying a new method for you to understand better. Yes. Listen and write down whatever you can predict.
For questions 1 to 24, complete the note patient called Melissa Gordon. Questions 1 to 12. You hear an obstetrician talking to a patient called Melissa Gordon. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Notes is not here. We are not looking at the notes. We are trying a different method to develop analytical skills in listening. Okay. analytical listening.
So this first meeting, Mrs. Gordon, is mainly a chance for you and I to get to know each other. I'll ask about your medical history, and this is also an opportunity for you to ask me any questions that you've got at this point.
Sure.
So some background. What kind of work do you do?
I have a job at an engineering company. I'm a computer programmer. I currently do 4 days a week, but I hope to reduce that to 3 after my maternity leave.
Ah, excellent. So tell me about your medical health. Do you have any conditions I should know about?
Well, I have asthma attacks, but they don't happen often. I lost about 10 kilos, and that certainly helped. I have an inhaler, but I hardly ever use it. Oh, I should also let you know that I come out in terrible hives if I take penicillin, but not other things. I'm fine if I eat nuts, for example. I have a fairly healthy lifestyle. I'm a vegetarian and I've never smoked.
Good.
I'm afraid I don't go to the gym or anything, but I walk to work and generally keep active.
Oh, that's good. So this is your first pregnancy?
No, I have a daughter called Ella. She's 3 now.
Ah, and did everything go smoothly that time?
There were no major problems during the pregnancy itself, but it took me quite a time to fall pregnant the first time. After having various tests, I was given some fertility drugs. Oh, what were they called? It's on the tip of my tongue. Never mind, it'll come back to me. This time, though, I didn't need any help.
Oh, it's no problem. What about labour last time round?
Oh, that was a nightmare. Though everything, thank goodness, worked out in the end. It was a breech birth. It looked as if I might have to have a caesarean, and I really didn't want that. I was pleased I managed without an epidural, too. They had to use forceps to get Ella out, but I didn't need any stitches, so that was okay. Unfortunately, though, I had some difficulties after the birth, too. I was desperate to start breastfeeding, but that didn't work out. At least not until I was given some guidance by the midwife.
OK. So can I ask you about the baby's father?
Sure. That's my husband, Paul. There's something in his family history that I should tell you about, I think. His grandfather and father both had epilepsy, though he hasn't developed it himself. I'm not sure if that means his children have a greater chance of having it or not. Oh, also, he has a child from his first marriage, and she has Down syndrome, so he gets a bit anxious when I'm pregnant.
Oh, well, that's understandable, of course. We can discuss various testing options if you like. You might want to consider amniocentesis, for example.
But that carries a risk of miscarriage, doesn't it? I don't want to go for that. I've heard about another test called CVS. Is that something to consider?
Well, it's certainly an option. However, that procedure, in fact, also carries a small increase in the risk of miscarriage. And you'd need to come to a decision fairly soon, because it's normally carried out between weeks 10 and 12 of the pregnancy.
Well, I can tell you straight away that if there's more risk, then I wouldn't consider it. I know my husband will feel the same.
Well, that's fair enough. So, is there anything else you'd like to ask me about today?
Nothing urgent. But it'd be good to know more about how to get siblings ready for a new addition to the family. I want to make sure Ella doesn't feel threatened or replaced or anything.
Well, there's a leaflet that many parents find helpful. Here we are. Have a look through that.
Oh, thanks. That's great. I'm sure I'll have lots more questions at our next meeting.
And if you are competent in listening A, you are competent in speaking. Doesn't mean your fluency, but the flow of the conversation. You are doing exactly what is being done here. You have to ask the patient questions and elicit answers. Any idea about the medical history? Anything you got?
Breech pregnancy.
The asthma attack for the asthma attack.
No, that is down below. What kind of work?
Engineer, computer programmer.
See, one mistake you can make. This is a real trick played in most of the audios. Somebody said engineering. There is a real problem here. You can just check. We'll listen to it one. There is a clear trick repeatedly played.
Medical history, and this is also an opportunity for you to ask me any questions that you've got at this point.
Listen now, what kind of work do you do? Listen carefully. Engineering is given there. what is connected to engineering. Listen carefully. What comes after engineering? Then what comes with next line?
Sure.
So some background. What kind of work do you do?
I have a job at an engineering company. I'm a computer programmer.
What is the answer?
Computer programmer.
I'm a computer programmer.
Computer program. Engineering is not the answer because I work in engineering company. Engineering company can have different designations. But I work as a computer programmer.
Computer programmer.
Okay. So that is the trick being played. The question is not where do you work, in which company. First she is saying, I work in an engineering company. I work as a computer programmer. This should be very analytical when you listen to this. Will be repeatedly used. This trick will be played. And medical health conditions. Do you have any conditions? What when should you mention?
Asthma.
Yeah. Anything about first? Was this a first pregnancy?
No.
Second, she have a
Child called
Anything about any problem with the first pregnancy?
Fertility issue problem.
She has some medication.
Medication. Yeah. So here you have second question you have, that is the first question actually. What kind of work you do is a designation, profession. Name of a profession, designation. Then, do you have any conditions? Name of a disease. Asthma. Name of a disease. We are dealing with names, okay? Then listen to, you have to identify the names. Then, first pregnancy. Again, you dealt with the name of a
condition.
Condition, maybe fertility, something like that, right? It's a condition, right? Or treatment, whatever.
Treatment.
Okay? Treatment. Name of a treatment. Okay. The next one was, did everything go smoothly that time?
Fertility drug.
There's the emotional word expressed. You have to listen to those words. Oh my.
Nightmare.
It was a nightmare.
She saw nightmare.
Nightmare.
Why is that? Anything special you
No,
heard?
that is about labor.
Breach. She has breach delivery. Breach birth.
That was about labor. Yes. Did everything go smoothly that time?
No.
She explained about medication, what she took that time. And during the labor experience, she told that it's nightmare.
Yeah, that is exactly labor experience. But here, did everything go smoothly that time?
She took the medicine for the infertility.
Fertility is here, right?
Father here,
No.
I'm sorry, Father. Father,
something else.
Smoothly time we answer would be fertility drugs or only fertility.
Yeah. Now I am creating confusions in your brain. That is the best part of our learning. You argue, no problem. When you listen next time, you'll be very careful because the other girl was saying that one. Oh, no, I am right or she is right. Okay? If she is right, don't talk. If we are right, shout out. Okay? Yes. Let's listen. We'll listen again. Then what about labor last time around?
Nightmare and breech presentation.
Nightmare, anything?
Breech presentation.
Breech birth using force of
epidural and
breech birth. Breech birth spelling. Breech spelling. Breech spelling. Instead of B-R-E-E-C-H, if you make it B-R-E-A-C-H, that will be entirely different. Spelling, one spelling change can change the entire meaning, okay?
Yes.
That is a breach of contract and other things will be breach,
Yes.
B-R-E-A-C-H. Here it is breach. Breach means foot coming, feet upside down, not the head coming out, right? That's it. Yeah.
Yes.
Abnormal, not normal birth. Okay, can I ask you about the baby's father?
His name is Paul.
Husband, father.
And father.
Father and grandfather.
Husband and grandfather, they have epilepsy.
Epilepsy. Again, name of a condition. See, most of the answers will be names of a condition, profession, designation, treatment, test, something of this sort. So even if he is asking about baby's father, you should be concerned about what was his problem, what sickness he had, because you are just eliciting medical history. I will ask you about your medical history. So here they are asking family medical history, baby's father.
Family history.
Yeah. Then we can discuss various testing options if you like. One of the testing options. Normally, what comes from the mouth of the interviewer, professional, will not be the answer. 95+%. Answer will be coming from the mouth of the patient.
CVS, father.
Yeah, CVA, probably. Other one, the specialist did mention something, but that will not be the answer normally.
Yes, amniocentesis.
Is there anything else you would like to ask me about today?
Nutrition.
To prepare for next baby.
Prepare the elder sibling about the next sibling. So leaflet will be given. This is the exact responses for your speaking, okay? Exact responses. Ditto. This is how you have to ask the questions and elicit the answers. This should be your response to the patient in your speaking. So write down and practice listening. Part A is ditto your speaking role play card. Do you understand?
Yes.
You will be playing the role of this professional. Maybe you are a registered nurse, but you have to take the medical history. You have to ask questions and elicit the answers. All types of questions and our responses will be given in listening part A. Shall we listen one more time?
Yes,
so that all the doubts can be fixed. Let's see. We will be listening more time, okay, don't worry, with other clues.
I currently do 4 days a week. But
to look at the notes.
Father, no voice.
It's coming.
No,
it's coming.
No.
It's coming. They have given time to look at the notes. We don't have notes. You can look at the questions. This is the time for you to smile.
So this first meeting, Mrs. Gordon, is mainly a chance for you and I to get to know each other. I'll ask about your medical history, and this is also an opportunity for you to ask me any questions that you've got at this point.
Sure.
So some background. What kind of work do you do?
I have a job at an engineering company. I'm a computer programmer. I currently do 4 days a week, but I hope to reduce that to 3 after my maternity leave.
Ah, excellent. So tell me about your medical health. Do you have any conditions I should know about?
Well, I have asthma attacks, but they don't happen often. I lost about 10 kilos, and that certainly helped. I have an inhaler, but I hardly ever use it. Oh, I should also let you know that I come out in terrible hives if I take penicillin, but not other things. I'm fine if I eat nuts, for example. I have a fairly healthy lifestyle. I'm a vegetarian and I've never smoked.
Good.
I'm afraid I don't go to the gym or anything, but I walk to work and generally keep active.
Oh, that's good. So this is your first pregnancy?
No, I have a daughter called Ella. She's 3 now.
Ah, and did everything go smoothly that time?
There were no major problems during the pregnancy itself, but it took me quite a time to fall pregnant the first time. After having various tests, I was given some fertility drugs. Oh, what were they called? It's on the tip of my tongue. Never mind, it'll come back to me. This time, though, I didn't need any help.
Oh, it's no problem. What about labour last time round?
Oh, that was a nightmare. Though everything, thank goodness, worked out in the end. It was a breech birth. It looked as if I might have to have a caesarean, and I really didn't want that. I was pleased I managed without an epidural, too. They had to use forceps to get Ella out, but I didn't need any stitches, so that was okay. Unfortunately, though, I had some difficulties after the birth, too. I was desperate to start breastfeeding, but that didn't work out. At least not until I was given some guidance by the midwife.
OK. So can I ask you about the baby's father?
Sure. That's my husband, Paul. There's something in his family history that I should tell you about, I think. His grandfather and father both had epilepsy, though he hasn't developed it himself. I'm not sure if that means his children have a greater chance of having it or not. Oh, also, he has a child from his first marriage and she has Down syndrome, so he gets a bit anxious when I'm pregnant.
Oh, well, that's understandable, of course. We can discuss various testing options if you like. You might want to consider amniocentesis, for example.
But that carries a risk of miscarriage, doesn't it? I don't want to go for that. I've heard about another test called CVS. Is that something to consider?
Well, it's certainly an option. However, that procedure, in fact, also carries a small increase in the risk of miscarriage. And you'd need to come to a decision fairly soon because it's normally carried out between weeks 10 and 12 of the pregnancy.
Well, I can tell you straight away that if there's more risk, then I wouldn't consider it. I know my husband will feel the same.
Well, that's fair enough. So, is there anything else you'd like to ask me about today?
Nothing urgent. But it'd be good to know more about how to get siblings ready for a new addition to the family. I want to make sure Ella doesn't feel threatened or replaced or anything.
Well, there's a leaflet that many parents find helpful. Here we are. Have a look through that.
Oh, thanks. That's great. I'm sure I'll have lots more questions at our next meeting.
Now, let's do one magic. Whatever the thing you feel will be the answers, just write down on your notebook. We don't know what are the questions at all, okay? We have not seen the questions. These are from the audio, questions from the audio script. Questions we are going to look into, okay? This is 500 grade training. Usually we do when the people are expert, we go reverse. We try to frame questions. What could be the questions? So that's the best way of learning. Okay? Just write down. Number one, what kind of work can be one answer? Like that. Just those words. If you want, I can play it one more time. By the meantime, just write down, okay? Then we will post it in the Telegram group. I will watch it. And let me see how much, because we can't post it here, I believe, in the YouTube comment space. Okay, if you can type, you're fast enough to type, you can type there in the YouTube comment space. Or you can write, you can write in the notebook. And then you can type if you want. I'll give you 2 minutes to type. Let's see. So one more time, you will listen. At the same time, put 1 to 12 numbers, 1 to 12 numbers in your notebook. You may miss some answers. It's cool.
Excuse me, Father.
Please.
Excuse me, Father.
Yeah, I'm listening.
Father, do I need to write this question also?
No need of questions. 1 to 12.
The answers.
The answer, only the answer, word or phrase. What could be the answer to these questions? So what could be the questions 1 to 12? We don't know what are the questions. Okay, these are not questions. We'll have patient notes. If you want to see, I will show you. No, if I show you that, you will have some clues. Okay, let's see without any clues. Okay, one more time I'm playing it. Did you put 1 to 12 number?
Yes, Father.
1 to 12 in your notebook?
Yes, Father.
Yes, Father.
Okay, now let's listen. And whatever comes to 1 to 12, you can, need not be exact order, okay? Any order is okay. Just try how many answers you can find.
Father, again need to write. I'm sorry, Father.
Yeah, you have to write in front of 1 to 12 numbers, no? 1 to 12. Again, write, don't worry,
Father,
that's a practice. Not these questions, not these questions. You are going to prepare questions. You are going to prepare questions, 12 questions for the OET aspirants. You may not prepare now. You just write what could be the answer. For example, what kind of work do you do? You said computer programmer.
Computer programmer.
So that is the answer, one answer. Second answer, do you have any conditions?
Asthma.
Yeah, exactly. So let's see how many you can find. In between, there will be not exactly one question, one answer. For this one question, there could be 2 answers. That's okay. Just let's try. If you can, all of you together can find 12 answers, that will be great. Let's check how far we can go. Listen and write up.
This is mainly a chance for you and I.
Now it starts, okay?
So this first meeting, Mrs. Gordon, is mainly a chance for you and I to get to know each other. I'll ask about your medical history, and this is also an opportunity for you to ask me any questions that you've got at this point.
Sure.
So some background. What kind of work do you do?
I have a job at an engineering company. I'm a computer programmer. I currently do 4 days a week, but I hope to reduce that to 3 after my maternity leave.
Ah, excellent. So tell me about your medical health. Do you have any conditions I should know about?
Well, I have asthma attacks, but they don't happen often. I lost about 10 kilos, and that certainly helped. I have an inhaler, but I hardly ever use it. Oh, I should also let you know that I come out in terrible hives if I take penicillin, but not other things. I'm fine if I eat nuts, for example. I have a fairly healthy lifestyle. I'm a vegetarian and I've never smoked.
Good.
I'm afraid I don't go to the gym or anything, but I walk to work and generally keep active.
Oh, that's good. So this is your first pregnancy?
No, I have a daughter called Ella. She's 3 now.
Ah, and did everything go smoothly that time?
There were no major problems during the pregnancy itself, but it took me quite a time to fall pregnant the first time. After having various tests, I was given some fertility drugs. Oh, what were they called? It's on the tip of my tongue. Never mind, it'll come back to me. This time, though, I didn't need any help.
Oh, it's no problem. What about labour last time round?
Oh, that was a nightmare. Though everything, thank goodness, worked out in the end. It was a breech birth. It looked as if I might have to have a caesarean, and I really didn't want that. I was pleased I managed without an epidural, too. They had to use forceps to get Ella out, but I didn't need any stitches, so that was okay. Unfortunately, though, I had some difficulties after the birth, too. I was desperate to start breastfeeding, but that didn't work out. At least not until I was given some guidance by the midwife.
OK. So can I ask you about the baby's father?
Sure. That's my husband, Paul. There's something in his family history that I should tell you about, I think. His grandfather and father both had epilepsy, though he hasn't developed it himself. I'm not sure if that means his children have a greater chance of having it or not. Oh, also, he has a child from his first marriage, and she has Down syndrome, so he gets a bit anxious when I'm pregnant.
Oh, well, that's understandable, of course. We can discuss various testing options if you like. You might want to consider amniocentesis, for example.
But that carries a risk of miscarriage, doesn't it? I don't want to go for that. I've heard about another test called CVS. Is that something to consider?
Well, it's certainly an option. However, that procedure, in fact, also carries a small increase in the risk of miscarriage. And you'd need to come to a decision fairly soon, because it's normally carried out between weeks 10 and 12 of the pregnancy.
Well, I can tell you straight away that if there's more risk, then I wouldn't consider it. I know my husband will feel the same.
Well, that's fair enough. So, is there anything else you'd like to ask me about today?
Nothing urgent. But it'd be good to know more about how to get siblings ready for a new addition to the family. I want to make sure Ella doesn't feel threatened or replaced or anything.
Well, there's a leaflet that many parents find helpful. Here we are. Have a look through that.
Oh, thanks. That's great. I'm sure I'll have lots more questions at our next meeting.
Got it?
Yes.
Yeah, now just can you type in the comment space just the answers? Number 1, 2, 3, 4.
Father, I missed.
If you find, it's okay, it's okay. If you miss, don't type in. Whatever you got, you can just type in. Otherwise, if you find difficult to type in, you can take a screenshot and put it in the platform. I can look there. But you can type in here, I believe. I'll give you 1 minute just to type in. Yeah, somebody has already done it. Computer programmer, asthma attack, fertility, only whatever you got it, okay? I'm back in.
Mom.
Okay. Almost everything you got it, right? Shall we go to the next step?
Yes, Father.
Okay.
Yes, Father.
Yeah. Can you just fill in this as you go on? Listen for name. Just the names. Okay. Names in the sense professional or designation, illness, condition, medicine, drug, treatment, lifestyle, daily activities, food, diet, medical instrument, diagnosis, test. Just make these columns. Just write down these head. This one. This what is given in the right side. Professional or designation. You can just write short forms. Okay. Pro, desig. Illness you can write. Drug you can write. Cool. Drug is enough. One is enough. Lifestyle or diet you can write. Medical instrument you can write. Name. All these are names. We are dealing with names these days with the episodes, right? Diagnosis test. Can you fill in all the columns with some words that you have written down or typed in the comment space? Did anything go wrong? Reach delivery. Yes. Good. Almost all the answers are there. Combined. Yes. Designation, did you get? You can shout out as well. Those are in the Zoom classroom. Designation, profession.
The computer program.
Okay. Illness condition. How many illnesses did you have?
Asthma attack,
Asthma attack.
epilepsy,
Epilepsy, asthma. Okay.
epilepsy, asthma.
Yeah, drugs.
Down syndrome.
Down syndrome is epilepsy, asthma, epilepsy, Down syndrome. 3 conditions or illnesses. Then drugs, medicine.
Allergy to penicillin,
Penicillin.
Fertility drugs.
Fertility.
infertility,
Fertility. Yes. Then
epidural,
about lifestyle. About lifestyle. Daily activities.
vegetarian,
Food, diet,
Vegetarian.
vegetarian,
Vegetarian. Write down in front of it. Anything about medical instruments?
Forceps.
forceps,
Forceps. Yeah. While assisting at the delivery, right? Yes. Diagnosis test on abbreviation.
aminosynthesis,
CVS and aminosynthesis.
aminosynthesis,
Amniocentesis.
Yeah.
CVS.
What was from patient?
CVS.
Okay. Now let's try the real thing, okay? These are the real questions, okay? You will read and you will write. These are the real questions. Shall we go?
Yes,
Now let's see how many of your presumptions, foreseeing, prediction was right. Even without seeing the questions, you have predicted from the audio. Now fill in the questions, okay? Answers works as here. Listen and fill in. Try even reading the patient
Occupational English Test.
If there are
Practice
beginners,
test.
this is known as what is seen in the screen is known as patient notes, for which they give you some time to read.
1. Listening test. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear an obstetrician talking to a patient called Melissa Gordon. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
at this 30 seconds, you have to highlight the words before and after the gap. Something important, what is given here. For example, okay, person allergic to something and has a diet, then needed dash treatment, all those things. Okay, these are the golden seconds.
Preventive dash and required during intervention. For having birth problem.
So this first meeting, Mrs. Gordon, is mainly a chance for you and I to get to know each other. I'll ask about your medical history, and this is also an opportunity for you to ask me any questions that you've got at this point.
Sure.
So some background. What kind of work do you do?
I have a job at an engineering company. I'm a computer programmer. I currently do 4 days a week, but I hope to reduce that to 3 after my maternity leave.
Ah, excellent. So tell me about your medical health. Do you have any conditions I should know about?
Well, I have asthma attacks, but they don't happen often. I lost about 10 kilos, and that certainly helped. I have an inhaler, but I hardly ever use it. Oh, I should also let you know that I come out in terrible hives if I take penicillin, but not other things. I'm fine if I eat nuts, for example. I have a fairly healthy lifestyle. I'm a vegetarian and I've never smoked.
Good.
I'm afraid I don't go to the gym or anything, but I walk to work and generally keep active.
Oh, that's good. So this is your first pregnancy?
No, I have a daughter called Ella. She's 3 now.
Ah, and did everything go smoothly that time?
There were no major problems during the pregnancy itself, but it took me quite a time to fall pregnant the first time. After having various tests, I was given some fertility drugs. Oh, what were they called? It's on the tip of my tongue. Never mind, it'll come back to me. This time, though, I didn't need any help.
Oh, it's no problem. What about labour last time round?
Oh, that was a nightmare. Though everything, thank goodness, worked out in the end. It was a breech birth. It looked as if I might have to have a caesarean, and I really didn't want that. I was pleased I managed without an epidural, too. They had to use forceps to get Ella out, but I didn't need any stitches, so that was okay. Unfortunately, though, I had some difficulties after the birth, too. I was desperate to start breastfeeding, but that didn't work out. At least not until I was given some guidance by the midwife.
OK. So can I ask you about the baby's father?
Sure. That's my husband, Paul. There's something in his family history that I should tell you about, I think. His grandfather and father both had epilepsy, though he hasn't developed it himself. I'm not sure if that means his children have a greater chance of having it or not. Oh, also, he has a child from his first marriage, and she has Down syndrome, so he gets a bit anxious when I'm pregnant.
Oh, well, that's understandable, of course. We can discuss various testing options if you like. You might want to consider amniocentesis, for example.
But that carries a risk of miscarriage, doesn't it? I don't want to go for that. I've heard about another test called CVS. Is that something to consider?
Well, it's certainly an option. However, that procedure, in fact, also carries a small increase in the risk of miscarriage. And you'd need to come to a decision fairly soon, because it's normally carried out between weeks 10 and 12 of the pregnancy.
Well, I can tell you straight away that if there's more risk, then I wouldn't consider it. I know my husband will feel the same.
Well, that's fair enough. So, is there anything else you'd like to ask me about today?
Nothing urgent. But it'd be good to know more about how to get siblings ready for a new addition to the family. I want to make sure Ella doesn't feel threatened or replaced or anything.
Well, there's a leaflet that many parents find helpful. Here we are. Have a look through that.
Oh.
Got it?
Yes, Father.
Father.
Yes.
Just check
Yes,
your
Father.
answers. Computer programmer or a programmer, both are right. Even if you write programmer, that will be right. Computer program, both are right. Name of your profession or a designation. Asthma or asthma attacks, both are right. Name of a condition or illness. Penicillin. Allergic to penicillin. Okay. Name of a medicine. Then vegetarian. name diet, food, then fertility, treatment, name. Okay. In that audio, it is given drug. Here it is treatment, synonyms. Breech birth, a condition. Forceps or forceps, both spellings are correct. FORCEPS or FORCIPES, both are correct. Name of a medical instrument. Epilepsy, again, name of a illness or condition. Down syndrome, again, name of illness or condition. CVS, even if you write the full form, that also will be correct. Chronic villus sampling. Okay. CVS test, if you write, that will be wrong. Okay. Only CVS you have to write or the full form name. But always we suggest just write CVS. That's what is mentioned in the audio. Okay. By writing too many words, you may commit more mistakes and spelling problems. So name of your test. Then last one, sibling or siblings. Whatever. Okay. So this siblings is better. Don't confuse yourself with the options. Yes, you got siblings, right? So all these are names, right? Except the last one, except 12th answer, all the 11 answers came from the mouth of the patient. Okay, we'll check it. Now we see computer program from the patient, asthma attacks from the patient, penicillin from the patients, then fertility from the patient, breech from the patient, forceps from the patient, breastfeeding problem from the patient, epilepsy from the patient, Down syndrome from the patient, CVS from the patient, leaflet from the professional. So 98+% of the answers will come from the mouth of the patient. But then you have to listen to the questions to easily to follow the script. So we got the answers. Let's check. The practice method we have highlighted. Let's check if we can listen. One sec. Give me one step. Now, what is the next step in the 7 steps?
Check again.
Check
No.
again with the
No.
Script. With the script.
Huh? Listen with the script.
Yes.
Correct.
Father,
Yes.
Father, when I am writing the answer, I miss the other thing the audio is saying. This is happening to me.
No, that you get now. Yeah, that you will get by practice, ma. The initial stages you cannot get. Let me see if you can see the screen. Okay, we'll listen once with the script.
Father.
Are you ready?
Yes, Father.
yes,
Do you have the stamina?
Yes.
yes,
Let me share the screen. One second. Can you see this one?
Yes, Father.
You want me to make it bigger? Zoom it. It is already 400. Okay. Is that cool?
Okay, Father.
Let me know if you can hear the voice. If you can hear, go on reading and reading the script and highlighting whatever you can, write down whatever you can.
Occupational English Test.
Is it audible?
Yes.
Okay. You can see the script as well, right?
Yes.
Yeah. Now listen and read it.
Practice Test 1. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear an obstetrician talking to a patient called Melissa Gordon. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So this first meeting, Mrs. Gordon, is mainly a chance for you and I to get to know each other. I'll ask about your medical history, and this is also an opportunity for you to ask me any questions that you've got at this point.
Sure.
So some background. What kind of work do you do?
I have a job at an engineering company. I'm a computer programmer. I currently do 4 days a week, but I hope to reduce that to 3 after my maternity leave.
Ah, excellent. So tell me about your medical health. Do you have any conditions I should know about?
Well, I have asthma attacks, but they don't happen often. I lost about 10 kilos, and that certainly helped. I have an inhaler, but I hardly ever use it. Oh, I should also let you know that I come out in terrible hives if I take penicillin, but not other things. I'm fine if I eat nuts, for example. I have a fairly healthy lifestyle. I'm a vegetarian and I've never smoked.
Good.
I'm afraid I don't go to the gym or anything, but I walk to work and generally keep active.
Oh, that's good. So this is your first pregnancy?
No, I have a daughter called Ella. She's 3 now.
Ah, and did everything go smoothly that time?
There were no major problems during the pregnancy itself, but it took me quite a time to fall pregnant the first time. After having various tests, I was given some fertility drugs. Oh, what were they called? It's on the tip of my tongue. Never mind, it'll come back to me. This time, though, I didn't need any help.
Oh, it's no problem. What about labour last time round?
Oh, that was a nightmare. Though everything, thank goodness, worked out in the end. It was a breech birth. It looked as if I might have to have a caesarean, and I really didn't want that. I was pleased I managed without an epidural, too. They had to use forceps to get Ella out, but I didn't need any stitches, so that was okay. Unfortunately, though, I had some difficulties after the birth too. I was desperate to start breastfeeding, but that didn't work out. At least not until I was given some guidance by the midwife.
OK. So can I ask you about the baby's father?
Sure. That's my husband, Paul. There's something in his family history that I should tell you about, I think. His grandfather and father both had epilepsy, though he hasn't developed it himself. I'm not sure if that means his children have a greater chance of having it or not. Oh, also, he has a child from his first marriage, and she has Down syndrome, so he gets a bit anxious when I'm pregnant.
Oh, well, that's understandable, of course. We can discuss various testing options if you like. You might want to consider amniocentesis, for example.
But that carries a risk of miscarriage, doesn't it? I don't want to go for that. I've heard about another test called CVS. Is that something to consider?
Well, it's certainly an option. However, that procedure, in fact, also carries a small increase in the risk of miscarriage. And you'd need to come to a decision fairly soon because it's normally carried out between weeks 10 and 12 of the pregnancy.
Well, I can tell you straight away that if there's more risk, then I wouldn't consider it. I know my husband will feel the same.
Well, that's fair enough. So, is there anything else you'd like to ask me about today?
Nothing urgent. But it'd be good to know more about how to get siblings ready for a new addition to the family. I want to make sure Ella doesn't feel threatened or replaced or anything.
Well, there's a leaflet that many parents find helpful. Here we are. Have a look through that.
Oh, thanks. That's great. I'm sure I'll have lots more questions at our next meeting.
Beauty? Okay.
Excuse me, Father.
Yes.
Father, that asthma attacks, they have like in answer options, bracket is, they put bracket. So
yeah, brackets, whatever is put in brackets, it means without that word, asthma itself is enough. That was also right. If you write both the words, that's also considered right.
Okay.
Okay, both the options, asthma attack or asthma, both are right. And there is a question at YouTube comment space. Do they penalize for spelling mistakes? Definitely. Very often there is a misunderstanding. In listening, spelling mistakes are okay. But there are two conditions. Minor spelling mistakes are tolerated in listening, but there are two conditions. What are the conditions? Your word that you have misspelled should not be changing the pronunciation of the word. Second condition, meaning should not be changed. Instead of breach, B-R-E-E-C-H, if you write B-R-E-A-C-H, the meaning has changed.
Yes.
So don't look for spelling mistakes, especially the names of the conditions, professional names. If you make a simple spelling mistake, you will be penalized because you are a health professional, right? You are supposed to know for epilepsy spelling. So minor mistakes in the sense, for example, if you write butter, B-U-T-E-R, butter, maybe it's okay. Instead of 2 T's, you have 1 T, that's okay. But don't look for it. Always look for perfection. Why do you take the risk? So if you ask me, does the spelling mistake cost you reduction of marks? My answer is yes, yes, yes. Okay? So don't take it lightly and say the spelling mistakes are okay in the listening module. It's not okay. If you make a mistake, either pronunciation will change or the meaning will change. Without that, if you can make a spelling mistake, try it, no problem. That they will not penalize. Okay, I'm actually sending this to the main platform. Okay, this document. Why is it?
Check again and practice.
You have to, I am sending it to main platform. You have to practice it. Okay, I have even, you have the highlighted portion in the first, second portion without highlights, okay? Did you see it? And it's in the main platform. Okay, I have highlighted the answers and all since you have worked it out. But the thing is, you have to find out all the synonyms. I will also send, maybe thank you admins, they actually arranged me immediately when I asked them the materials. I will send it again, the whole material I will send. That means, do you remember? It was there in the admin panel. There is the material. We can just remember, repost it in the admin panel. The PDF material. Admins, did you see the material being posted?
Yes.
Can you just repost it in the, or post it in the main platform?
Okay. Okay.
I've also posted the audio, okay? Yes. Who has, did you post it in the main platform, admins? Okay, got it. Thank you, Elizabeth. Okay, I have pinned the material, audio. Just save them, okay? Right. So try to practice it again and find out from the questions. It is there in this particular material. You will find third one. Let me check. Yeah, here you will find the questions as well. Question booklet is there, right? Please test. No questions here. No questions, right? Can somebody share the question if you have? Or a screenshot I can share. One sec. From the PPT. One sec. I'm sharing the questions screenshot. Questions got this pin. Answers as well.
Occupational English Test. Practice Test 1. Listening Test.
In the meantime, if you have any queries, you can type in the comment space. I'll answer you. I'm sending a couple of nice things.
At the start of each extract, you'll hear this sound.
Please mute those who have distractions. Yes. Now you have even the answer highlighted. Then we have, what is it? Yeah. Yes. Yeah. Everything is given there. Yeah. Try to find out all the synonyms. Okay. Questions. Yeah, questions are given there. Yeah. Thank you, Elizabeth. Yeah. Now, whenever you have time, try to work it out. Okay. And whatever your insights, you can share as well. Yeah. I know a little long it was, but
can you hear me?
Yeah, please.
Can you hear me?
Yes,
I have
listen.
some network issue.
Yeah.
If you wrote the answer asthma attack means I wrote asthma attack.
Yeah,
Okay,
that
but
is okay.
spelling of attack is wrong.
Attack, one
It's
T
okay.
is missing,
Okay.
that will be cool. If one T is missing, that will be cool. But then,
I think I wrote C
pardon?
ATTACHS, something like that. I wrote CATTACHS.
Yeah, but if you
Something
check
like that.
that
I
way,
wrote.
pronunciation will be
Not
changed.
I
If
can
the pronunciation is changed, you will not get marks.
change.
But like, for example, attack, two T's are there. If you miss one T, yeah. Hello? Did you get the answer?
Yes.
So, Father, how about this one? S. If we don't write plural, if suppose singular writing attack, only attack, no S. I mean, if we miss the S, it will be
If you miss
penalized.
you will be penalized because attacks is plural, not one time.
Okay.
Yeah. If it is plural, it has to be written plural because meaning will be changed, right?
Yes, yes. Actually, when hearing time, I heard attack.
Okay. So listen now carefully. That's why I said you try to listen this continuously with the script. That will really help you for developing your listening skills. Because when you're reading the script, you understand, oh, this is how they pronounce, this is how they read, this is how they slide away, this is how they give stress, all those things. Anyone knows whether I have done this session earlier, this particular listening material? Have you seen my videos, uploaded videos?
No, Father.
No, right? Because I don't know what all things I have dealt with.
No, Father.
Father, not this one.
Not this one, right?
Yes.
Thank you. Suddenly I saw one material, then I asked that the admin panel, so they could give me the details, then they provided with audio, script, questions, everything. Yeah, that's why I could manage. Otherwise, searching is a big issue. Yes. I know it was a bit long because we can't help because 12 questions. 12 questions must be taken, right?
Yeah.
Yes. Anybody wanting to join here for a direct interaction with me? I am posting the Zoom classroom link in the YouTube comment space. Yes.
Father,
Come
this
on.
12 question is part A, right?
Part A, listening part A.
Up to 24.
Yeah, 12 more are there, but you don't, since you don't have stamina, even otherwise it will be too much for you. Even I was finding difficult to complete 12 because it's a long time when you go through the steps.
Yeah.
This is how those who are advanced can practice this way. Okay, listen to the audio. Don't look at the questions. Write down the names, different names. See, we are dealing with names in the episodes, right? So you're going to see even in listening B, listening C, reading B, reading C, especially A and C, you will find name as one of the topmost tips to find the clues for the anchor point for locating the answers. Now what you can do, one thing, listen to the audio, take down the case history. Take down, imagine that you are in the real situation, meeting a patient. Okay, take down the case history. Or in the active batch, we will give you by tomorrow. We'll give you like active batch. You can say admins. You can, those who are in the active batch can just forward a notice asking them to select learning partners. Okay, whoever is convenient with your time zone and all those things, you can select yourself. Then we'll approve it. Then what you can do, you can take this and speak out. One will be the specialist, other one will be the patient. Then the specialist has to take down the case history. the medical history. Okay, what are the things patient is speaking, and all those things will be the answers. This is exactly what you do in your medical profession. Nothing special. But maybe in India, you don't intervene much. Only doctors do it. But when you go abroad, you have to do all these things. Okay, because I have done my psychiatry. When I did my psychiatry PG, I had to do all these case 64 big sheets with the psychiatric patients. All these details I had to take down. Yes. And it's not easy to with the psychiatric patients, like to elicit the answers, it's challenging. You have to counter it with the parents, with the polite partner, with the children. Then you have to compare whether they are saying the truth, all those things. Yes. If you have not clicked the like button, just click the like button and share to your groups wherever. And also see that you subscribe the channel. If you have not subscribed, then only you'll be able to message. We are closing down the live stream, okay? If you want, you can join. The link is given there.